What's up, guys? Dr. Dan over here with Megan.
Hi.
Megan is in her 4th pregnancy right now, 3rd trimester, right?
35 weeks.
35 weeks pregnant, 4th pregnancy. Megan's been a patient since her 1st pregnancy with Nora, who you guys will see on another video. Nora's now 7 years old, right?
Mm-hmm.
And prior to Nora, never was a chiropractic patient before, right?
Right.
And I think it was your mother or your father that sent you in here.
Yes, both.
Both. So both her parents are patients at the office. Megan became a patient. She was 40 plus weeks.
Yeah, I think I was pushing 41 weeks.
Yeah, not going into labor.
Mm-hmm.
No contractions or light contractions. And so we see a number of women, you know, early in pregnancy, later in pregnancy. Always better to begin chiropractic care early in pregnancy so you can learn how to bend, how to twist, how to stretch a little bit. Things that will help balance out the pelvic floor, the abdomen, the low back. Stance is very important. Exercise is very important so that you can maintain good circulation, good blood flow, good fluid movement throughout your body. How was 2nd and 3rd pregnancy?
Good. Yeah, they were good.
Easier than 1st, maybe?
Much easier, yeah.
Less pain?
A lot less pain. My labors were significantly different.
Yeah. But still pain, though, right? Still soreness.
Yeah. Well, that comes with being pregnant.
Yeah. So body structure changes, ligaments stretch, pelvis has to open up big time. So very common to have a lot of like low back discomfort. Sometimes women even get like the round ligament pain, the inguinal tension and pain. I think you were dealing with some of that just recently.
I was,
bit.
yeah.
Yeah. Adductors, your inner leg muscles, really important to also kind of like stretch out and get nice and comfortable. Okay. So you guys will get to see Megan's appointment. You'll see how we get her adjusted. Neck, mid back, low back. We'll do some side posture stretching. And a couple things we've been working on this pregnancy, just reiterating important points of postural awareness for neck tension reduction, shoulder tension reduction, good healthy movement up in the neck, good healthy movement up in the shoulders. Let's go hands back and down gently like that. We always, no matter if we're male, female, pregnant, non-pregnant, we always recommend taking, hopefully throughout the day, 10 to 20 minutes of nice little postural awareness to help stretch and elevate the spine, pulling the shoulder blades down and back, feeling her nice strong arm muscles elongate upward, feeling these back muscles pump up a little bit, and definitely feeling the spine arch gently, right? This is a nice, easy position. We can sit in on the couch, on the kitchen chair, or the dining room chair, wherever it is that we do a lot of our sitting at, working into some gentle coiling or twisting left, a little bit of coiling or twisting right. And we can hold each of these positions for anywhere from 10 to 60 seconds and just kind of focus on how nice it feels to stretch the spine out gently. The second thing we want Megan to do is include a little bit of neck stretch and a little bit of neck decompression, a little bit of cervical spine elongation so that we can just feel any tension. Do you have a little bit up in the neck or nothing really?
I do, yeah.
A little bit of tension. So she's got 2 or 3 kids currently, and they're definitely all running around wild and playing in the living room and playing outside and running around the house, right? Trashing it like they do, right? And Mom says, I need some deep meditation and some quality mom time to just stretch my neck and feel a little bit better. You can sit anywhere as the kids play on the ground and be mindful. Take a little time to elongate the neck, to stretch the neck, to roll the shoulders back and down. Let's lean the head to the left a little bit. And maybe you just want to kind of close your eyes and just hang out here for a little bit and just feel how gravity does such a nice job and letting the head fall to the side and just starting to stretch the neck out a little bit. Is that cool? Back to center, let's look left. And as we look left, we want to think, let's really kind of try to feel this little stretch over on this right side. Maybe we want to tilt back a little bit. Maybe we want to hold that and lower the shoulder a little bit. Maybe feel.
Oh, I feel it.
Yeah. So we can hold that for 10, 20, 30 seconds. And then we can go over to the right side gently. We're going to just kind of like, just relax here. Take a deep inhale. And as you exhale, just twist a little bit. Maybe lower this left shoulder a little bit. Nice. And you'll feel how that, do you feel that side stretch right through there? Nice. Back to center. And you can put palms back up on thighs right there, all right? So, important throughout all stages of life that we decrease neck tension, that we be mindful that we're elongating the neck, we're lowering the shoulders, we're developing some good postural awareness. The Hypervolt's an awesome tool for pregnancy, definitely. It's soothing, it's relaxing, it's muscle, nerve, skin, connective tissue therapy. It's stress reduction, especially after a long day with your kids, right?
Definitely.
Maybe it's good quality time with hubby. You can sit on the floor. Husband can sit behind you and work out mid-back a little bit. Go ahead, lean your head to the right for me. Or if not, then you come into the chiropractor's office, or you find a good physical therapist or a chiropractor. They can administer some similar treatment, some stress reduction treatment, some soft tissue tension reduction. I'll switch over to the left side. Sore.
This is the side I hold Amelia on.
Yeah, good point, right?
Yeah.
So when we're momming or dadding, we've got lots of duties. We've got our house duties. We've got our cleanup duties. We've got our carry the kids around duties. Lift the kids up. Pick the kids up. Take them here. Take them there. Carry them. Mommy, I want to hold you. Daddy, I want to hold you. All sweet stuff to go through as a parent. But she knows, Megan said, this is the side I carry. Who?
My 2-year-old.
Your 2-year-old, yeah. She carries the 2-year-old on this right side a lot. So it's common to, hike the shoulder up, developing gradual muscle tension, muscle spasm up here. If you let that stuff sit in your body, it can manifest, it can facilitate, it can grow into more shoulder pain, more neck pain, more muscle imbalance. Megan, throughout, oh my gosh, probably 8 years of knowing you, I guess 7 years of knowing you, has improved her posture dramatically. We should see some nice adjustments today out of her body. We should see some good stress reduction out of her body. How have you felt, how do you feel, I should say, after getting adjusted versus before?
Really good.
It's a good
it relieves all the tension on my left leg gets very swollen when I'm pregnant, and it relieves all the tension down here and all the tension on my lower back.
And each treatment helps relieve it, right?
Mm-hmm.
So treatments help to relieve muscle imbalance, skeletal imbalance, stress throughout the body, like we said a number of times already. At-home stretching, at-home therapy, super important to stay active throughout your pregnancy. Rocker position, which you guys have seen in other videos. Hip hinging, some wide stance work to really help the pelvic floor, the adductors and the leg muscles loosen up. Also important, and feels super good. Symptoms Megan's experienced. Tell us about your ear.
So my ear, I have a lot of tension all around my ear that goes down my neck and into my shoulder. My ear won't drain. And actually, since you've been working on this side the last couple of weeks, my ear actually did finally drain.
Did it really?
It did, yes.
Awesome.
It fully drained.
Awesome. And so, guys, super common. She has had stress, tension, tightness up in the neck. Sometimes we call it cervicocranial syndrome. Or if it gets really bad, you can have like occipital neuralgia, like compression up in the neck, up in the shoulders, up around the occiput. The occiput is the base bone of your skull. And where we've definitely felt, Megan, over the years, carry, right?
I used to have very bad pain up like in the base of my skull. I had that for years, I think even as a teenager. And since seeing you, I don't actually get pain there at all anymore.
And sometimes you don't even realize it, right?
Yeah, I didn't realize that's why my head was, like my neck and the back of my head was hurting so bad.
And that's crazy, right?
It is crazy.
And so many times your kids, and when I was a kid, I when you're a kid, you complain to your parents like, oh, this hurts and that hurts. And I grew up in a, super blue collar family with a farmer dad and a farmer grandpap, and you know, suck it up, let's get back to work and let's do your farm chores and all that stuff, and don't address your pain. It'll go away, right? And then before you know it, maybe you're having headache, neck pain, skull pain, occipital pain all throughout high school. Yeah. And then you turn into an adult and look down for me. And you've had skeletal stress, muscular stress, muscle imbalance for decades, maybe 20 years, maybe 30 years. And your body is constantly changing. It's constantly either progressing or it's regressing. We want to progress. We want to do our postural stretches on a daily basis. We want to be mindful of our neck stretch. We want to feel the cervical spine loosen up gradually. And let's go up here, way down, up, way down, up, way down, up, way down. Megan's neck's been adjusting like butter, super smoothly. Look down for me. Look up, look down for me. Look up, look down for me. Look up, look down for me. But we have all of our day-to-day stress. And when I say stress, I mean our tasks, our chores, our duties, the positions that we need to put ourselves in, the habits of always carrying the little kids on the right side. You know, so you feel when it builds up, like, oh man, my neck is tight, my shoulder's tight today. We're gonna pull this down a little bit. Okay. Move this right to here. Look up straight, look down straight. Look up, look down. Let me pull that over there.
Sorry.
That's okay. Look up, look down, look up. Guys, what we're doing is, you've seen in other videos, just a little upper, look up, look down, a little upper back, upper shoulder, soft tissue treatment, a little bit of muscle stripping, muscle or myofascial release therapy. Look down for me. Look up, look down, look up, look down, look up, look down, look up. Look down, nice. Feel it. Yeah. Feel it, kiddo. Look down. Look up. Look down. Nice. Now let's hit this trap a little bit. Lean your head to the right and left. And right and left. So about head, neck, face, sinus swelling, pressure in the ear. You know, we have to breathe. We have these holes. They're called orifices, holes, or foramen, a hole. And you have ear holes, you have nose holes, you have eye holes, you have mouth, one mouth hole. And that's where we breathe all of our, you know, environmental allergens in. Dust, dirt, dander, pollen, mold, when the weather here in Pittsburgh is cold and rainy, and then sunny and hot, and we get all 4 seasons here in Pittsburgh. And, you know, you might get irritation, you might get sinus congestion, you might get lymph node swelling, you might get sinusitis, you might get sore throat from environmental allergens that, you know, make their way into our body, that clog up our lymphatic system, causing a lot of that congestion, that pressure up in the head, the face, the neck. The ear may get clogged. So if we improve posture, we reduce muscle tightness, we get some of this right here to flush down into the arm and down into the torso. We push all this fluid down through the body, right? We push all this fluid down through the body. We loosen up the neck, the shoulders, we improve the elevation of the head and help drain all that stuff downward. So ultimately it can go down into our intestinal tract, down into our guts, and out through the body. Cool? All right, stand up. Guys, the cool thing about this table, and most chiropractors, if they treat pregnancy patients, you know, it has a drop away here. So Little baby's gonna sit right here nice and comfortably. Megan's gonna be able to lay down nice and comfortably on the table. Let's go ahead. All right, good work. We're gonna lift the pelvis just a little bit, just to stretch. We're gonna start with a little bit of pelvic decompression, light rotation. You okay with that so far?
Yes.
Does belly feel comfortable down there?
Yes.
Awesome. Feels good to lay on this excuse me, on this table?
Yes, it does.
Yes.
Yes. Very comfortable.
So with the chiropractic tables, they're firm, but they're cushioned. And it really helps your body to lay out nice and flat. When we're pregnant, we get recommendations not so much to like lay flat on our back, right? Because the baby can, as baby grows, can compress the aorta, and just really not too good to lay super flat on the back for a long period of time. So face down can really help to alleviate stress and tension in the low back. Other things, and you guys may have seen on some other videos, that common to have pelvic misalignment where the sacrum gets a little out of balance, the muscles throughout the body get a little out of balance. You can have nerve, artery, or vein compression, which can cause swelling into one leg more than the other leg. And Megan said it's always her left leg, and we can just even feel down here that this left calf is more swollen than the right calf, right?
Yes.
Is it sore if I squeeze?
A little bit, but not too bad.
Not super bad. So good at-home therapy is vibration to the hips. She can do it herself a little bit with Hypervolt at home. Here in the office, we're going to work out left hip, right hip. We'll even do a little bit up in the mid-back, and then we're going to treat down here in the calf a little bit just to get some stimulation down into the lower leg. Sometimes when we do Hypervolt around the hips, a little bit of this vibration makes its way up into the abdomen, into the little baby. You may notice some kicking a little bit, maybe a little bit of movement. Do we know boy or girl?
That's a boy.
It's a boy, that's right, that's awesome. So he might wake up here a little bit. We're not going to use the Hypervolt on the abdomen at all, or around the flank, around the low back. But totally okay to use down here in the pelvis. And around the hip joints and around the sacrum. Megan's going to just work on a nice breath in, nice and deeply. And a nice breath out. Activity is very, very, very important. Breaking bad postural habits, super important as well throughout pregnancy, so that we don't end up with 10, 20, 30 weeks of ongoing low back pain that worsens. Once baby's delivered, that's when we can really get back into some hands-on muscle therapy, some deeper penetration of the Hypervolt down into the hip muscles. But during these last couple weeks, where we're just providing some symptomatic relief, making sure that the structure stays generally straight, the pelvis stays generally balanced, the baby doesn't move into a breached or a twisted position. And if that baby spins in the abdomen, it can create all kinds of discomfort for mom and increase tension in different areas throughout the low back and the pelvis. They can become pretty uncomfortable. Did you ever have a breech baby at all?
I did not, no.
Never. Have any of the kids ever had an ear infection?
No.
Isn't that awesome?
Nope, no ear infections for us.
Many times, and Nora's 7, and Lucas
is 4.
4.
And 2. Amelia's 2.
We've adjusted all the kids from the day that they were born, or the first week that they were born. Mom and Dad gradually have you know, learned and developed probably a little bit more comfortable patterns of kind of stretching a little bit and training their kids to sit in good posture.
Yep.
So a lot of the appointment also is kind of educational, learning what to do, how to talk to your kids, how to teach them how to sit the right way, how to softly work on their neck when they do complain after a trampoline jump or something like that. Oh, I kind of like tweak something or something hurts. And mom and dad can provide some nice touch relief, some nice therapy. And the power of touch is so powerful, the power of touch, to take pain away. And when you have kids, right, like, oh, I got a boo-boo, it hurts, you know, and you tell them, it's okay, it'll be okay, and then before you know it, they say, it doesn't hurt anymore, right?
Yeah. Yeah, you worked a lot with Lucas and his posture.
Oh, and the breathing as well, right?
Yes, yeah, his breathing when he was first born.
Because what happened? Did he have like a cord issue or something?
He did, yeah. He was born very quickly and had the cord around his neck.
Yeah.
And he was chest breathing.
Yes.
Yeah.
And really short, shallow breathing.
He was,
right?
yeah.
So with her second child, Lucas, who's 4 now, he had a little bit of, it wasn't an easy birth, but it was a little traumatic and a little bit of cord issue. So he came out in this really hyperventilative state. And when we first saw him, he was chest breathing a lot. We had to work gradually with some muscle work to re-educate his diaphragm and get him to calm down a little bit. But trauma during birth, both for mother and also for baby, can be lifelong, and you can kind of get stuck in a hyperventilative state where you breathe too fast, too shallow. Long-term breathing dysfunction can create all kinds of like low back tension, neck tension, and as we get older, things like headaches and neck pain. And then what we're doing with the hypervolt with Megan, just kind of treating down the lateral line, so the glutes, the IT band, down into the back or the posterior side of the calf, the back of the knee. Sometimes the hamstrings get a little sensitive, so just try to deep breathe through Meg.
Okay.
Have you had any round ligament pain or lower inguinal pain, lower abdominal strain, anything like that?
Yeah, all of that.
More so the past like couple weeks, or was
my
it?
belly getting bigger.
No diastasis recti with the first couple?
I did. I actually had it with all of them. With
I
Nora,
re-
I
that's
worked
right, I
with
remember
you,
that.
and it closed back up. And with Lucas, it closed back up, and then I think I got pregnant again too quickly this time. It was almost there.
And we did a lot of core reactivation.
Mm-hmm.
Yeah.
We did. Yeah.
So another common condition, some, not all, probably more than less, I don't know the stats on it, but diastasis recti, where the belly splits due to, growing abdomen. Go ahead, push in my hand for me. And stop. And push. And stop. And push. And stop. Nice. And push. And stop. And push. And stop. And she is doing awesome, super duper flexible. One more time, big push. In the right hip. Maintaining awesome quad stretch, quad front chain flexibility. Push one more time. And stop. Back down for me. Let's see what the left leg does. And the left leg is the side that gets a little more swollen.
Yeah.
It feels a little tighter too.
Yeah, it does.
Push. And stop. You guys can see it's a little bit shorter of a range of motion. Push. And stop. Go ahead, push. And stop. Push. And stop. and push, and stop. And push one more time, and stop big time. And push, and stop last time, good. And so a little bit of leg stretch helps to balance the hips out. Let's check that against the right leg again. Definitely a little easier, right?
Yeah.
Definitely a little easier. We're about half an inch to an inch away here. There's a little bit more knee flexion versus the left side, which is a little further away and probably feels a little more tension in the front of the thigh a little bit. Push again and stop. And push one more time and stop. Nice. Back down. All right, good work. Foot pain, plantar fasciitis, Achilles issues, calf strains. Have you had any calf cramping at all?
I actually haven't had too much. I usually get it late, like into the 3rd trimester, and with keeping my calves pretty loose, I've had a little bit, but not too much.
Nice.
I have to say that may have been one of the worst things in my first pregnancy when I did not get work done, was the cramps in my calves.
Yeah, definitely. So common to have calf spasm, calf cramping. You can have like pseudo contractions down in the calf when you're actually supposed to be having like abdominal and lower abdominal contractions, pelvic floor contractions. Sometimes the brain gets confused and it starts cramping up and creating strain and tension down in the calves. So maintaining good back chain flexibility, important, will help keep the nerves, the muscles stimulated down into the lower extremity. All right, let's go. Exhale out, whole way down, easy. Good, good. Deep breath in, exhale down, nice. One more in, big one. Exhale down, nice job. Okay, easy thoracic spine adjustments. Now head back a little bit like that. Let's try to do one more through here. Inhale deep, exhale deep, whole way down. There's that last one. All right. Now let's go ahead, face right side up over to. All right, now side posture, guys. Everybody feels a little bit different in this position. So if the abdomen is nice and flexible, we can generally easily get breath in, exhale out. Nice, good. Other side for me. We're going to be real gentle with our setup. Our setup's going to be up here. This is going to be a little bit of anti-rotation, a little bit of rotation backward as we rotate. Exhale out, the way out. Nice, flat your back for me. And Megan right now, like we said, is 35 weeks. Feels comfortable rotating, right? Not too uncomfortable. So safe and effective to do some low back pregnancy adjustments for the lumbar spine, the pelvis, and down into the sacrum. And now right foot. Good. Then guys, why we use paper towel for some of the foot adjustments, gives us a little bit better grip, a little bit better traction. We're going to spend a second here, or a couple seconds, just kind of stretching the feet out. Is that uncomfortable at all?
No.
Awesome. Twist your knees open gently for me.
Ooh.
Oh.
I can feel the stretch.
Feel the stretch. So this is a great position. This is what I call the double bow set stretch, the double bow set lie. And what we're doing here, one, we're lying on our back, and two, we're plantar flexing the feet down and in gently. And we're going to ask Megan to twist right knee open gently. Let's hold that. And now twist left knee open gently. You might notice, what do you notice?
Wants to cramp.
You're cramping already? A little bit?
A little bit.
Twist it a little more gently, right there. So she told us at the beginning of the appointment, the left leg is the one that gets more swollen. Let's relax now. Can you just scooch up the table just like an inch? I'm gonna lower this down just a little bit, nice.
that good?
Yep. Perfect. All right, so we're going to spend about a minute plantar flexing the feet, gently twisting the knees open. Let's do both right there. And I want you to gently think about the right foot, and I want you to curl or squeeze your toes down real gently. And then I want you to curl or squeeze the left toes down gently.
Oh.
Cramp, find that cramp up there.
Yeah, my leg wants to cramp. So.
And now let's focus right knee open, right foot squeezed a little bit. Do you feel how this side's a little stronger?
Yeah.
And now left side. And now relax, good. So we're going to recommend to Megan at home. She does, maybe in bed at night, lies on her back for a little bit of time. Gently squeeze your toes down for me. Focus on this right foot, those right toes. Try to curl this big toe a little bit, nice. Try to curl the left foot or point the left foot down. You feel how that's tough?
Yeah, this is like more work than it appears.
More work than it appears. Brain activation down to the foot curlers, the intrinsic muscles of the foot, the plantar fascia, the calves, cramping a little bit.
Yeah.
Okay. Neurological stimulation, neurological activation, brain control down here into the feet, right? Now when she's on her feet all day long, gravity squishes us to the ground. Now that we're 35 weeks pregnant, we also have additional weight up in the body. The arches of the feet sometimes collapse in, the feet and the calf leg and the leg muscles get a little weak. So we want to take a little bit of time in a non-weight bearing position. And that's going to be your flat on back for gradual foot activation. A little bit of right foot squeeze for a while, and a while would be 20 or 30 seconds. And then a little bit of left foot squeeze for a while. And you may feel this left leg is a little tighter on the top of the foot. You may feel this knee might be a little, or the thigh might cramp a little bit. If I say, let's go right foot with the right knee open, and you want to hold that for 20 or 30 or 40 seconds. And you can just breathe comfortably like she is abdominally. And then let's think left foot and left knee open a little bit, right through there. Or you feel that side?
Yeah.
Wants to cramp up a little bit? Nice. So when we put her in the correct body position, the best structural alignment, balanced femurs, balanced tibia, balanced fibula, with a little bit of left knee open, she's going to reactivate probably the IT band, maybe the vastus lateralis, one of the quad muscles, up in the left side of the leg, the left side of the hip. She may get some light cramping. This is a simple exercise that will help us identify muscle imbalance up in the pelvis and in the legs, and ultimately get you to kind of like strengthen your muscles really gently, right? It's not super high intensity exercise. It's nice, easy foot control, nice, easy calf control, nice, easy leg control, okay? Let's bend this left knee up. And we're gonna go nice and gentle right into a little left knee adjustment. And this side is your better side, so it's not going to move because it's already nice and loose. Nice and unrestricted. And now right ankle. Now let's do this left ankle again. All right, good work. Recommendation for at home work, a little bit of foot squeezes. Don't need my hands here, but you can do this by herself. A little bit of knees open gently. A little bit of focus on the right leg, and then a little bit of focus on the left leg, okay? All right, fingers, wrist. Relax fingers. And wrist and thumb, good. And gently relax that elbow right there. That's kind of tight already.
That's a little bit tight.
So common to have a lot of in life, a lot of down and in, a lot of grip, a lot of food preparation, a lot of driving, a lot of carrying. The elbow commonly gets tight. The forearm flexors commonly get tight. Bend your elbow, so pull your wrist into my hand like that. And then let's just stop. And let's pull. And let's stop. Feel how that kind of stretches all this out right through here. And then pull. And then stop. Roll shoulder open gently, nice. Bend one more time here. And stop. And she's got a little reflexive muscle strain / stretch down here. And gradually we're just working in the elbow to open up the bicep, the forearm flexors, get her to become a little more flexible through here, help reduce any kind of elbow pain or tension. Let's see if we can get the index finger now. There we go. All right, so just with a little bit of connective tissue stretch up here, we can loosen up the digits, the extremities, the fingers, the phalanges, all kinds of terms for those guys. Phalanges the funniest. Your fingers called your phalanges. And now, thumb, and now. Bend elbow, so pull into my hand. How's this side feel? Similar?
Actually, this one felt tighter.
The right one?
Yeah.
Well, remember the right ear, I think, was the clogged one. So she's all kind of like just a little bit jammed up in the right side. Bend left elbow up. Stop. See, this side moves a little easier. Let's see if we can get a little. She's not been to the point where we get both elbows to move yet, but on her way. Hands here. Last step. Gonna be cervical spine on the left first. Relax left neck over here. Nice. And relax right neck. Nice job. Oh. Oh, whoops. All right. So previously, right neck congestion. So we've talked on previous visits about ear work, about neck work. And even though we got this right side loosened up, adjusted, stretched out a little bit, you know, she's had a bad guy up here, a bad old injury up here, up in this right upper suboccipital region. We spoke a little bit about occipital pain, ongoing, not ongoing, but previous occipital pain that's decreased significantly. Neck continues to get healthier with each treatment. But we definitely feel, right, Megan, how this is still just a little bit stuck up here in this upper right CO. When we say CO, meaning occiput, C1, C2 vertebrae on this right side. And that's just going to be the area that we got to continue to work on. We got to continue to be mindful of our finger, wrist, elbow stretches. And once we get baby number 4 out and healthy, then we'll get back to some higher level neck, arm stretches, stuff that can be done a little bit better after pregnancy's finished up here. Okay? Okay. Roll to your right side and see what's awesome pregnancy video. Yeah. Guys, that's Megan here with Dr. Dan, 35 weeks pregnant. If you're experiencing any aches, pains, low back discomfort, swelling down the legs, the extremities, you can be helped. You can be worked on. It's safe. Chiropractic care is safe for a pregnancy. So thank you guys. We'll see you on future videos.